Today I was operating on a guy who was actually suffering from severe pain with diminished quality of his life owing to the pain and deformity in his knees, and he had severe osteoarthritis in his knees.
I'm just showing you once again, she has got a great form of osteoarthritis. On the X-ray wise, it's more a symptom more on the left side.
There are a large subset of people in our society who suffer from this particular problem. So the treatment regime in osteoarthritis depends on its stage. At the time of the surgery, I just forget that there are people watching, because for me, it's not the spectators who are important, it's basically the patient who is important. The only thing which was different was I had to go a bit slowly because I had to explain the steps to the spectators, because there might be very young surgeons in the auditorium. So rather than finishing in about 1 hour, we took about 1 hour, 35 minutes.
Oftentimes when you read a text, you see the perfect way to do things, and oftentimes in live surgery, things don't always go the way you want them to go. You also see how they get out of trouble. It's really, really easy to see the different techniques that they use and compare it and contrast to how you would do things. You talk about fast surgeons, what they do to be fast. No one is fast because they move fast. They come to a fork in the road, they've been there a million times, and they know which way to turn. And sometimes you can put yourself into the mind of the operating surgeon and say, okay, I know what he's going to do next because I've come to that place myself before.
We did a live demonstration surgery today with arthroscopic ACL reconstruction. This guy is a 34-year-old who had an injury to the knee joint. He'll be unable to participate in the sports activities. The scan showed that he had an ACL tear, which usually requires total reconstruction in a young people, otherwise it will lead to a lot of other complications. We used keyhole camera technique. We do minor small incisions to get into the joint, but the camera will be showing us what needs to be done on a big screen. We made a new graft for him, new ligament for him where it should be in an anatomical position, and we have fixed it properly. So we are expecting a good result in him. Maybe he'll be able to get back to his sports or his pre-injury level in about 6 months' time.
ACL is a very common injury in this part of the world, with the demographics of the population being a very young population over here. A lot of people go out and play sports, and this is one of the most commonly injured ligament. So a bulk of our sports injury work is regarding the ACL. Now with the newer techniques that we are doing, Zulekha Hospital, we are constantly improving. We are constantly improving ourselves, which in turn helps the patient's recovery, and the general well-being of the patient. You can present a lot of work which has been edited, which has been cut, cropped, and pasted and done. But the live demo is actually theater. I mean, it is happening then and there. We as surgeons can also get into a problem. The best thing about is that the people who are there at the other end are the ones who are learning, who know what will be the next step of these surgeons, how to get out of the problems, and how to do a good job at the end of the day.
Today is an excellent program, which is a live, interactive, operative program, which is very rare in this part of the world. And it is very interactive, that makes us surgeons to visit and get a first-hand, transparent knowledge, which is the requirement of today's CME.
Surgeon who's doing the surgery is interacting with the audience, and he's also answering their questions. It's quite difficult for the surgeon to answer questions and to start thinking and explaining his procedure. It makes the procedure a little bit long, but it's beneficial.
It's a good experience because it shows you the technicalities and the difficulties that surgeons might have. At the same time, you can see the tricks that each surgeon has to overcome whatever obstacle they have.
We will see in the panel discussion later on. We have some comments, we have some queries we will ask, and I think it will be good opportunity to know the surgeon idea and his surgical tricks.
The surgery went very smoothly, and the pictures were very clear, and I myself have learned a lot from these two cases.
Presenting live demonstration is completely different from arranging some written work or some paperwork. You will have too much stress in the preparation of surgery before you will start into the surgery.
We had a great team supporting us. We had a great case. In the end, we did well.